Hi, my name is Rachel Briggs. This is my submission video for medication administration. I am with Haldol. First, I'd like to show you my supplies here. I've got my hand sanitizer, my sharps container, gloves, alcohol pads, gauze, my lemon, my needle syringe, which is I chose the 22 gauge by 1 to 1.5, which for adults, that's a safe needle usage for IM injections. And I also have a 3 ml syringe, my name tag, and tape, the Haldol, which is, I'm noticing, a 5 milligram per ml bottle, and the expiration date is, I'm so sorry, I gotta put my glasses on here. Expiration date is 7/2033. So, and I have my MAR here. So the first thing I do will introduce myself to the patient and verify her identity. I'll knock on the door. I'm going to wash my hands. I'm going to provide privacy. And I will check the patient's armband. Her name is Millie Larson. I will ask her, is your name Millie Larson? If she's able to answer, yes, Millie Larson. Birth date 1/1/1936. It is 1/1/1936. She says yes. I ask her if she has any allergies. Do you have any allergies? Okay, good. Well, I am, my name is Rachel, and I will be giving you your medication this evening. I look at the MAR. I've got my MAR here, and I want to make sure that this is indeed the right patient. I'm checking with her wristband. Millie Larson, birth date 1/1/1936, birth date 1/1/1936, medical record number 123456, medical record number 123456. So I did discuss the choice in the needle and syringe, and the appropriate for the adult being 1 to 3 milliliter syringe with a 21 to 25 gauge needle that could be used. So I have, I'm going to, Miss Larson, I'm going to put you in a position that is the safest to give you an injection. You're feeling a little agitated, and I'd like to do something to make you feel better. So I'm going to lay you on your side, and we'll get you in a comfortable position. And what this medication will do is it'll be an injection into your hip. It's called the ventrogluteal site, and it will be quick, and hopefully it will make you feel a lot better. So I will lay her on her side, and depending on what side I have her on, it's going to depend on the hand that I use to make her skin taut. Use that V method with my thumb pointing toward the crotch and the other at the iliac crest, and then I will give the injection down at the V site. When I go to wipe around with the alcohol pad, I will leave the alcohol pad, since the lemon's small, I can't really do it. I'll leave the alcohol pad with a point towards where the injection site would be. I will be giving it at a 90-degree angle, and I will also aspirate 3 to 5 seconds to see if there's any blood. If there's no blood return, then I will give the injection. Often they use the ventrogluteal site so that because the muscle mass is more and there's a less chance for blood aspiration. I also had to do a drug calculation for the 5 milligrams per ml that the haloperidol is, and it is ordered that she get haloperidol 2 milligrams intramuscular now for control of agitation. Doing the math calculations, I did divide the 2 milligrams by 5 times 1, and it equaled 0.4 mLs. So that's what I will be giving today, is 0.4 mLs. And we will start. Let me just wash my hands one more time. Okay, Miss Larson, I got you positioned on your side here, and we'll get you, are you comfortable? Okay, and I said I'm going to ahead and give you your medication now. I'm going to draw it up. So I will take the Haldol here, And I will actually, I could do this, but undo my packaging here. So this is the 3 ml syringe, and I will attach it to the 22 gauge needle with 1 by 1.5. I will take the alcohol pad and wipe off the edge of this. I will make sure there's no air. I want to make sure that I draw up 0.4 mLs. Oops. I'm gonna make sure there's no air bubbles. 1, 2, 3, 4. Okay, 1, 2, 3, 4. I don't know that you can see this. I'm hoping that you can. No air bubbles at all. And it is at 0.4. I'm trying to get this to where you guys can see it. Where you can see it. Hope you can see it good. Okay, so then we got that. Got the patient into the proper position. And I will now, this is going to be the hip, laying on the right side, everything I explained to you prior, as far as the, you know, how I told you how I would do it and get the skin taut with finding the ventrogluteal site, thumb towards crotch, other towards the iliac crest, V, and I will make this my injection site. And I will take an alcohol pad, or well, actually I will take don my gloves, and I will, oops, excuse me, alcohol pad here, going in to out, not making sure I don't repeat. I'm trying to get this in the best position here possible for you, so you think this is good right here. I also want to take my tape, marking down that I'm giving the Haldol 2 milligrams, which would be the 0.4 mLs. Tape here. Okay. Now I'm going to do it at a 90-degree angle. The ventrogluteal site, 90-degree angle. First, I'm going to aspirate, make sure, for 3 to 5 seconds, make sure there is no blood, none, and then I will inject. We'll put the safety feature on here, put it in my sharps container, and I can use my gauze to make sure there's no bleeding. Are you in a comfortable position, Miss Larson? Okay, good. Let's get you situated onto your back, and I will make sure that she's safe, and then I will make sure there's no bleeding, and I will make sure she's comfortable, and they put her call light in reach. Thank you.